Good afternoon. Thank you for joining us today for IBPAP's industry briefing in partnership with Globe Business. We will begin shortly. In the meantime, please go on mute to avoid any disturbances. We look forward to a very informative session. Good afternoon and a warm welcome to IBPAP's industry briefing in partnership with Globe Business. Today's industry briefing is centered around the new normal workplace safety post-ECQ, understanding these guidelines for health and safety under GCQ. So today we have around 220 unique member companies joining us for this session, and we have a very special speaker from the Department of Labor to provide us insights and actually answer our questions. Before we begin this afternoon's session, may we please request all participants to go on mute. Please note that we will have a Q&A session towards the second half of the briefing, and we will be thrilled to answer some of your questions. For those of you who've also submitted questions ahead of time, we have taken note of that and will provide feedback. Notes will be sent off to all those who attended after this event, so stay tuned for that as well. But before we begin and take it to our keynote speaker, allow me to formally welcome and introduce to you IBPAP's President and CEO, Mr. Rey Untal.
Thank you, Indu. I hope everyone can hear me.
Yes, we can hear you.
Okay. Thank you again, Indu, and welcome to everybody who had made time to join us in this very informative industry briefing session today. As Indu has indicated, in our registration, I think we have set a record in terms of, I think, more than 400, in fact, who have confirmed to attend this particular session, representing easily more than 200 of our members. I would like to take this opportunity to likewise acknowledge a few of our trustees who will be joining us here today. Our Vice Chair, IE Campus, and the Chair of Infosys is here. We also have Rey Untal, who is the country head of Henkel, as well as the GICC Chair. Of course, special thanks goes to Globe for helping us host tonight's event, or this afternoon's event rather. Maraming salamat ulit, Globe. And last but not the least, of course, we have to thank our special guest, ASEC Tess Cucueco o DOLE, Doc Tess. Maraming salamat po sa inyong pagpapaunlak sa aming imbitasyon. So today's session, aptly titled POST-ECQ, the new normal for workplace safety, is very appropriate given the signified interest of many of our members. I think everybody's excited for us to be able to finally exit, hopefully by the middle of May, exit ECQ. And I understand that there is a lot of preparation being done on multiple fronts. And I have been peppered, in fact, with a lot of queries around what exactly do we need to do in preparation for the lifting of ECQ. And Tess can attest this. We have been coordinating with their new office for a few weeks now, and it was really appreciated that last week they released, together with DTI, a joint memorandum that covers the interim guidelines on workplace prevention and control for COVID-19. Now, I know for a fact that this session will be very interesting. We have received several pages of questions already, and that's why, if you would notice, we have deviated from our typically hour-long sessions, and we made an exception for this particular case and extended this to 2 hours. Now, if we don't get 2 hours, that's fine. But just to accommodate the many questions that we have seen, we put in that much time for us to be able to cover them comprehensively. So with that, I would like to turn back the floor to Indu, who will introduce our keynote speaker. Back to you, Indu.
Thank you very much, Mr. Rey Untal, for that welcome remarks. So we're very excited this afternoon to actually hear from our keynote speaker about the new normal workplace safety post-ECQ. I think we're all excited how we can move forward past May 15th. So without further ado, allow me to warmly welcome our keynote speaker, Assistant Secretary Teresita Cucueco, also known as Dr. Cucueco, from the Department of Labor and Employment. Her areas of expertise are around policy and program development and implementation of matters concerning work conditions and safety and health. Once again, please be reminded that questions will be addressed at the second half of today's webinar, but without further ado, allow me to warmly welcome once again Dr. Cucueco. Dr. the floor is now yours.
Thank you to IBPAP and for inviting us to share this very important document. I know many, even before this came out, many have already been asking us about this. And in fact, they were asking, the details of the new normal, especially for workplaces. I think, it's best to start already because I think you do have a lot of questions. I've already seen some of them or most of them. And so let's go through the guidelines. First, let me say that these are interim guidelines. As we discover more information on COVID-19 with the DOH, we will, guideline, that's why it's interim. There may be, and the possibility is large that there will be changes. If we know something more on testing or more, then of course we will be issuing the necessary directives. So for now, so that when there would be a lifting from the ECQ to a GCQ, but this is still, of course, going to be applicable to ECQs anyway. We already drew up these guidelines, and together with us, of course, is the Department of Trade and Industry. Next slide, please. This is just a background. Of course, you know all of this, the declaration of the public health emergency, and then the ECQ that was implemented and then extended. And now we are looking at the May 15. Hopefully, I think everybody wants that we are now going to modify this to a GCQ. But actually, yes, the interagency has also been looking at this very closely. Next, please. For the whole guidelines, the objectives are clear. It is really to assist you in looking at the minimum health protocols and standards. We are dovetailing in these guidelines with the DOH. We came after the DOH issued their administrative order 2020-15, which is the risk-based mitigation measures of for COVID-19. And that really covers all sectors, all areas, including workplaces. This is a more detailed guide for workplaces, but like I said, we needed that mother document from the DOH so that we can now proceed and do what is necessary for the workplace, again, aligning our guidelines with that of the DOH. So this is going to apply, of course, to the private sector. Next, please. The 4 objectives that you note here are the objectives also of the DOH standards, as I mentioned in the administrative order. It looks into, of course, 4 dimensions in the control and prevention of COVID-19, which is, of course, number 1, that we have the resistance, our workers, through proper nutrition, exercise, they will be able to, they have the immunity, or their immune system is well, so that they can overcome any disease, COVID-19 included. The next objective would be reducing the transmission, and you will see the different steps that we have, of course, given you in this guideline, so that transmissions would be reduced in workplaces. Then, of course, knowing that there will be the possibility that someone may have COVID-19, then let us look at how to minimize this contact rate. And finally, the last objective is to reduce the risk of infection from COVID-19. These 4 parameters are the ones that you will also find in the DOH objectives. Next, please. So in increasing physical and mental resilience, I think most of you have seen the guidelines, so I'll just go through this very quickly. Definitely diet, that the food should be nutrition and well cooked. In the beginning parts of COVID-19, we also noted that they were saying avoid raw food. So because they said it may, there might be a possibility that it can be, there would be transmission, but what we're just saying now is nutritious, well-cooked food is good, and that should be taken in. Plenty of fluids and avoiding alcoholic beverages. That is, I think you know why we should be doing that, so that at least we do not overburden our liver. Then adequate rest and 8 hours of sleep, and of course, regular exercise. In looking at the resilience, we're also asking companies if they can provide, it's like we're saying, enjoin them to provide free medicines, definitely vitamin C and zinc. We have been reading so much about this. If you can provide it, thank you. And of course, referral for workers needing counseling or presenting with mental health concerns. The anxiety arising from COVID-19 because of so much unknowns, and because of what we hear for those who have had the complications, and the, you know, that it can happen anywhere and to anyone. That anxiety is so high, and that's why, you know, the call for the quarantine that already has again brought out so much mental health concerns. And recently, you know, just before COVID-19, we already brought out the department order on mental health programs at work. So if you already have this, if you do already have some, if there are already capacitated personnel who can counsel, who, you know, or you already have hotlines that are available for workers so that they can be assisted in terms of what is bothering them, then that is going to be very important for our workers. Next, please. Now, for reducing transmission, this is, of course, these are necessities now. The mask. We say that, of course, the mask is there as a barrier. If you are with and you're asymptomatic, or there's someone out there, or you, then at least now you have barriers, you have protection. So that mask should be worn at all times. In fact, even before entering the company, the mask should be worn. Sabi nga, dati, no entry, no PP. Now it's no mask, no entry. But that is very important. Then we also ask that, and this is being done everywhere, the temperature check, because this is really one good screening mechanism that looks into if we have, because fever is a major symptom for this disease. And it is simply, you know, having a temperature check is already one way of screening. And this should be recorded, and that daily health symptom questionnaire. We've been seeing questions here already and saying, why daily? You know, it's really hard in this disease because suddenly you are not going to feel well. And when that happens, what we're, you know, our overall objective here is that at work, we would like that there is assurance that those people who are going to work are feeling well. They're healthy. They do not have any complaints. And that's why the first and foremost, what we're telling all those who are not feeling well is please stay at home, monitor yourselves. If you know, if it's just something that is bothering you for the day and tomorrow you feel better, that's good. But if it becomes something worse, then stay at home so that you, if there's a chance that it might be any disease that would be, that might cause an infection, then you do not infect your coworkers. That questionnaire is very important, and it is daily because it puts your temperature, it provides you and your company with what am I feeling? Do I have sore throat? Am I having cough? Because that will already help them or help the company assess what is happening to you and give you the proper advice. Now, before going in, that alcohol is sprayed, that's just going to give us that the mechanism that whatever is, whatever microbes or germs that we have that from outside and we bring inside, at least we're disinfected as we put it. Next, please. We're also, because vehicles are, of course, one of a common of common use in any workplace, whether it's a personal vehicle or especially if it is a vehicle that is being used by companies, we would require that all vehicles should be disinfected prior to entering any operational hub. If it's a factory and there are vehicles that are needed, disinfection is very important. And then physical distancing. It's also known as social distancing, but this is a requirement. Now that we're entering GCQ, we do not remove we're not saying, even if you will see the omnibus guidelines that says you can put in 100%, put in 100%, but make sure there's physical distancing. Because if there is no physical distancing, then please do not even try to put in 100%. Because it is very strict. That is another way of preventing transmission. You have the mask as the barrier. You have physical distancing in providing that necessary distance or that area where if, you know, we will not transmit any virus or any germs because it will not fall in within our, you know, in our bodies. So again, these are very important items that should be in place. The physical distancing, the mask, the disinfection. Next, please. So it's 1 meter. You know, this was also a big discussion because they were saying, the WHO is already saying 6 feet, which is 2 meters. But considering certain workplaces, as long as you have the mask, as long as you also have the other, you know, you have other um, uh, ways of disinfection, of cleaning, and always sanitizing, then that 1 meter is already, would be okay. For reducing transmission, we're also saying that please clean and disinfect those frequently handled objects like the doorknobs, any other door handles, or the table surfaces where there could be secretions that might fall. Please disinfect that at least once every 2 hours. If you can do it more, then that's best. You know, once you sit in your table and just disinfect regularly, that's fine. What we're always saying and what is always being repeated now is wash your hands with soap and water frequently, because your hands are those that touch the surfaces, and your hands will also touch your face, your nose, your mouth, your eyes, where the virus can come in. But if you make it a habit that you regularly wash your hands, and you also try to avoid, of course, touching your face, that would be good. I know you say, oh, there's a mask, but you know, sometimes even if, you know, this is a new normal, we also don't know how we adjust to wearing a mask the whole day. But let us have it as in our mindset to wash our hands frequently, not to touch your face. Then, of course, to have that hand washing, it would mean sufficient clean water and soap in all washrooms and toilets. And because there would, like I said, there would be frequently touched surfaces, then you would need sanitizers in corridors, conference areas, elevators, stairways, and usually in areas where there would be much people density or workers density. Next, please. This physical distancing, 1 meter, front, back, side at all times. If it means, and you will see this later, redoing the work layout, then it must be done. If you want to put barriers, even better. Ensure that physical distancing is maintained. If eating, this is now looking at eating what, if you know the guidelines, we have prohibited communal eating, dining areas, which means to say, like sometimes in pantries, you're all gathered, you have the conversation. This cannot happen now because we know that transmission from talking, from secretions in our saliva will be there. We do not know the symptomatics. We might have asymptomatics. So that's why the mask is worn. And when we eat, let's not anymore have the communal dining spaces. It's best to eat in your own individual workplace. It's because you're going to remove your mask. And when that mask is removed, you might tend to talk. And again, the risk, I'll now move to risk. You have that risk again. So if you have no one to talk to, you're just eating, then fine, then finish the food, dispose of your waste properly, then leave. If you have no individual and it has to happen in canteens should then be laid out so that one person per table and the tables are also separated. Then it might mean having different meal times, then that is something that should be done. Policies will really change. Work times might even change, but this is really what we are facing so that we can avoid and we can prevent the disease. And for those in kitchens, it is really, it is required that the canteen, the kitchens, the tables, the chairs, all the appliances are also cleaned and disinfected regularly. Next, please. We are looking at alternative work arrangements, which means You will see later, of course, there are many types of alternative work arrangements, work from home, especially now taking off from the Department of Health term that they're using for the 60 years old and above, and even if you're not 60, but you have comorbid diseases like hypertension, diabetes, or you are a pregnant worker, then you might look at work from home as an alternative work arrangement. You might also look at different shift times, especially if you have a big workforce, and to provide physical distancing, you might have different work times to accommodate. These are now all the alternative work arrangements that you may wish to explore. We talk of discouraging prolonged face-to-face interaction between workers and clients, meaning to say, if you have clients that go to you and every day, if that is really the work, you might just want to have an online type of mechanism, so that instead of having to face them, or again putting yourself at risk because you will be exposed to the probable asymptomatics who may be positive, then it will reduce because it's now online. So these are what we're saying. Please look at other modalities so that you will not. And if it has to happen that there's face-to-face, then have the mask, have the physical distancing present. Next, please. Arrange office tables to maintain proper physical distance. I already mentioned this, the 1 meter. It can be more, better more, but at least 1 meter. And design workstations to allow unidirectional movement. That would avoid, face-to-face contact. So that if you're moving to the right, everybody moves there, then there's, you are avoiding that face-to-face. And it's, so you now have to have, directions on where to go. And this is why we also say that if there are stairs, if there is two or more stairs available, one may be a stairs going up and another one will be the stair going down. And we're talking of limiting people inside enclosed spaces, and we look at elevators. Yes, even elevators need physical distancing, even if you say, but we're all facing front. Well, still physical distancing is a requirement. And in the Dole, I was just looking at our elevator, and I was there, and I think it's just going to be the operator and one, at the most 2 persons, but that is how it's going to be. That's why stairs might be one of the methods so that we can get to our own workplaces. But if not, look at the elevators and see how you are going to let the elevators work, so that you can also, of course, bring in the number of people. But again and again, we will repeat, even if you have hundreds of workers, we are talking of work arrangements where you are looking at a workforce where you are putting them in, and there is physical distancing. If it cannot happen that the whole 100% will be there, then please start reducing the number of workers inside the work area. Next, please. That you encourage the use of stairs, and of course that online system for clients needing assistance. Video conferencing, if it would, the meetings, and we are not anymore stranger to video conferencing. For many of us, this has been the way we've been conducting meetings during the ECQ. We've been having them like 3-4 times a week, and I think we're all very familiar, and we do get things done with video conferencing as well. So if you have to meet, there were some questions here, how short is short? There was one time, and let me talk from experience, where there was a meeting and it was suddenly called off because we found out there was a person there who was positive for COVID. And of course, I was there in that meeting. It was like, oh my. Then it was like, why did you wait so long to tell us? But then the DOH helped, and they gave us a protocol and said, okay, Do not be scared as long as you know you're wearing your mask, you didn't have any physical contact, and you did not talk to him for more than 15 minutes with mask on. So, you know, I'm just giving this here because these are experiences that we had. So how long, how short is short? 15 minutes is, you know, there was that protocol was 15 minutes and you'll be fine. So you can use that. And that was with masks on already. So anything longer than that, maybe you might just like to try video conferencing as an alternative. Then, of course, the physical distancing should always be observed, and the minimal health protocols, which again would be frequent hand washing, the use of masks, the physical distancing. These will always be ways to minimize contact rate. Next, please. To reduce risk of infection, if you know, we cannot help it that suddenly, even if a worker would feel like, okay, he's well now, but then suddenly and throughout in the day, he might have already, or he might suddenly not feel well, then this is where, remember, in the beginning, before entry to a workplace, there is an area that should be identified. If it's in a building, that should be an area for the whole building. That's fine with us. We're not saying that if it's a building with multi offices, each office should have one. No, before, what we're saying is even at the entrance of the building, have that isolation area there so that they do not need to enter if there is already a concern. So identify that area, because if someone does not feel well, and that area is so designated because that should be frequently disinfected. It should not be, it's not an area that's a common use area. It's really an area where people will be moved or be isolated because there are health concerns that need to be attended to. So find that area. What we're saying is in the whole building, siguro naman, you know, even if like there's 1,000 people, you might not have 100 people suddenly. What we're saying, as long as it's well ventilated, it's isolated, people do not, you know, it's not in it's at a high density area where workers pass, so that you will avoid that contact. Now, if suddenly it happens, the clinic personnel who will attend to that person, of course, should have the appropriate PPEs. If we talk of surgical mask or cloth mask, at the minimum, it's a cloth mask, and that's in the guideline. For the health personnel, then it will not be a cloth mask. It will be medical grade PPEs. They will be in charge of assessing, and if the need is there, for transporting. And of course, we now leave it to the hospital to have the proper test. And here you will see that it is only in this area where we're saying that PCR testing is the test that because there's already symptoms that we advocate for this symptomatic worker. Next, please. Then, because he did come from his workplace, there should be decontamination, disinfection, and no one should be there right after decontamination, disinfection. The work can resume after 24 hours, but contact tracing here is also going to be very strict. So those who were in contact with this worker should go on quarantine. Next, please. Okay, it's not here, but if the worker on quarantine, if that suspected worker has a COVID-19, if the test result is negative, how about the workers who went on quarantine? Well, you know, you have to assess them also as well. But then what we're saying, at least there's already a chance that it is not COVID, because he is not positive, the suspect. So again, we are asking you that the health personnel would do the proper assessment. Now, we also advise workers that if there's anyone who is sick, and most likely not because of COVID, because we are all so fixated now with COVID-19, there are other causes of fever, there's wound infection, there's other, and if, you know, urinary tract infection. But what we're saying is, please let them stay at home, keep away from crowds, still take adequate rest and plenty of fluids, and still that personal hygiene, because if it is naman another infectious type of disease like the common colds or any flu, then let us also prevent the spread of the disease. Next, please. Now, if there is persistence in the symptoms, then appropriate medical care should be sought for. And here now, I think the telemedicine, if you can have that kind of approach so that anybody who's not feeling well will not need to physically consult, but they can use telemedicine, then that would be very good as well. Next, please. Okay, the duties of the employers. There should be policies that, you know, policies on the prevention, on the programs, because we are asking the companies, we are asking the employers to have all of these policies in place so that they should be followed. Then the necessary programs, what we're saying is have those IEC so that the workers are properly informed. What is COVID-19? By this time, but let us not assume that they know the transmission, and as you get to know more about the disease, that we also give that information to the workers and their families. We're asking the employers to provide the resources and materials needed to keep the worker healthy and the workplace safe. The masks, but we see the questions, should the masks be provided for daily? We're saying, wear the reusable masks, the cloth masks. That is good enough. It's reusable, it's washable. So you do not have to provide it daily. What we're saying is if it's reusable, then just add, tissue papers inside as an added filter. Now, the safety officer to monitor COVID-19 prevention. You've seen roving officers that have been written in the guidelines. These could be the safety officers. Sometimes they would, you might say, we don't, we are less than 9, at least, then you have your first aider, because a first aider is required in any, in all categories of a number of workers. So that safety officer is the one to monitor, to be the roving officer, to make sure the masks are worn, there's physical distancing, and nobody breaks the rules as we are implementing all of these prevention and control measures. Next, please. This on the health insurance provision, that it is enhanced if the employers can, because of course there are costs to this. Even if the PhilHealth has already provided and they already gave maximum benefits if it is COVID-19, but there might, of course, there will be additional costs that might arise, and it would be good if the employers can add this, but we're saying it's enhanced, that health insurance. So we leave it up to the employers. Provide shuttle services and decent accommodation on or near site location to lessen travel and people movement. This is taken from the ECQ. Remember, especially for you, for the BPOs, where you were allowed to work, because this was you are one of the few sectors who are allowed to work. The export-oriented business was another one. But it said at least there should be shuttle services, because transport was it was stopped. So those shuttle services would provide that, of course, the transport for the workers. If there is a common area to pick them up, that would be good. It's just continuing from the ECQ. If you can still provide accommodation near site, that would also be good. But now, because it's a little bit relaxed, and they can also start coming from their homes, and there is transport already that's going to be open for GCQ. But remember, it's not that even this would be less. That's why what we're always saying is, please, the workforce will really have to be less, because you are doing all of the necessary preventive measures like physical distancing. And even in the transport sector, that will also be it is considered. And join the hiring from local community if possible, so that you're just taking a person from the low, and he does not have to travel distances. And that COVID-19 hotline and call center. This is really many questions, many concerns, many fears are arising. And this would be a very good, I think the DOH has already, for the Philippine Psychiatrists Association, use these available hotlines. Make sure the workers know this, because for all we know, there is so much going on inside the work, especially because number one, there is no cure. And secondly, we have no vaccine. And short of that, we can only do our best to lessen the risk and prevent. Next, please. Workers, of course, we want that they comply with all the workplace measures for the prevention control of COVID-19, then that the proper respiratory etiquette, and it's all there, the coughing, the sneezing etiquettes, and of course, frequent hand washing. Next, please. Next, please. Okay, on testing. The first line is employers may test. We are not saying you should. You may if you want. But please understand there are protocols in place. The DOH has put the protocols for the testing of COVID-19. They have also put the protocols on how testing should be done. It is not supposed to be done by any person. There are accredited testing laboratories who should do the testing. What test kits, we leave it to you, but there are protocols to follow. Make sure you understand what is what the tests mean. If you say they're negative today, it's a rapid test. Does that give you the assurance they will be negative forever? You can answer that now and say no. So when will you test again? And what else would be needed? All of this should be taken in the context that we want to know what the workers are feeling. If they test negative and they feel fine, and that will be borne by the questionnaires, by the thermal scan, then it does have value. But if it's just a test and not knowing, remember, there are positives and negatives, there are pros and cons, because for all types there are two types, the rapid test and the PCR. But what is the best? If PCR is expensive, it can also lose. There might be false negatives in early. For the rapid test, there are also false negatives. It's really that you have to put when is PCR best done, and that's why we put there in when there is symptoms. But for the rapid test, when is it also best done? And you know that the IgM will come out if they do feel something, but if they do not feel anything, you might have an IgM that's negative, but there is already some but there is, it's already starting. But if it's an IgG after 14 days, you might see that there might be some value here. But again, will it always mean that they will be negative? There are so many unknowns. And that is why we will always come up with, and we will share with you what we do have, and even the DOH will continue to share with us what they have in terms of how to properly interpret the results. And that's why the nurses, the doctors are of course very valuable in interpreting all of these results. Next, please. We talk of the most at risk. This was the term used already by the DOH, and vulnerable groups. The most at risk, the senior citizens more than 60 years old, or those who are not 60 but with comorbidities, or those 60 even with comorbidities, and the pregnant workers. So we would like that they have that work from home arrangement. Although I think lately now you see so many senior citizens being very strong in their feelings that we are not that, you have to let us out too. But what we're saying is we have to understand that they are very at risk, especially because fatalities happen at this older age group. Now, because they are working from home, there should be proper work arrangements that should be developed to detail the deliverables. Of course, for the employers, you let them work, and you of course have outputs that should be given to you. Next, please. Okay. The DTI and the DOLE shall extend all assistance and technical support to all workplaces, employers, and workers in complying. We know that there might be some difficulties. We know that you might want to, that there will still be many questions. We are willing to work with the DTI, is also willing to work with you to help you in whatever assistance that we may give. Now on reporting, we do have the WAIR, it is existing, and please just submit it. We are preparing the online form. We will be posting it very soon so that you don't have to physically or mail it, or it will be done online. And I think this is the last slide. Next slide, please. Oh, okay. This is, we should just shared a sample protocol. You can use your own. You can really, because I already saw the DPWH, they also formulated their own. And it depends on you on what your protocols would be. Like we just shared with you, like this is going to be for the DOLE. We are a little bit stringent. We were using 37.5 as our cutoff because this is where sometimes they say there's already what we, in vernacular, CNAT, low-grade fever. And of course, it might be because they just came from outside and it was hot. That's why when you let them go back in, it would go down. But we just want to be a little bit more careful so that we can properly, of course, screen the workers. And this is all for the temperature. And the next would be on the questionnaire. Next, please. And these are the questions that we would ask. It is daily because every day you really have to find out what they feel. This should be really taken into bigger concept because this is a very important health questionnaire tool. And I think these are more questions. So these are the symptoms. Then just go back to the next, this one. Shared if they've been exposed to a COVID-19, that would mean they're suspect and there should be quarantine. Or anyone, if they have been in contact with anyone, you might want to explore what, if they already know what the sickness are, because definitely if it was not COVID-19, then they can answer properly to the medical personnel. The travel has always been there. We knew that because of China. Now, remember NCR, we will all, up to now, we are high risk, especially for areas where there is even, a cluster of cases. If your usual work, if your usual travel would be home, work, home, with no, then, the following day, at least, you were not exposed. But if there was a deviation, you might want to know, where did you go? Were you inadvertently exposed to someone or to another person who might be a carrier? So this would need further exploration in terms of that question. So again, that has to be properly assessed. And now I think this is the last slide. So thank you. Thank you for inviting us. I hope I was able to share with you the guidance in these guidelines. And yes, please feel free to ask any question.
Thank you very much, Dr. Very, very informative, very useful, and very timely for the members of the ITBPM industry. So as we're all slowly preparing for GCQ, there are several questions that have actually come in prior to this session, and we do have a lot of questions also on the floor. So I'm going to turn over the floor to Tess Asicates, IBPAP's HR consultant, to lead the Q&A. But before I do so, I just want to remind everyone that you could actually click on the Q&A icon below and submit your questions. And we do hope with your time, Dr. Tess, we're able to address all the questions. And once again, thank you very much for staying on. And I leave the now floor to Tess.
Thank you, Indu. Good afternoon, everyone. And we have a lot of questions. So Dr. Tess, we're going to keep Dr. Tess busy for the next hour. What I'd like to do is we received a lot of questions way before the briefing. And we also have a lot of questions that have been fielded in the Q&A chat box. So what I'll do is for the questions that we've seen already in the Q&A, we'll consolidate them with the questions that we received prior. And to make it easier for doctors and for everyone else, we'll shoot questions according to the 4 DOH minimum health standards, which is the way the interim guidelines are organized, okay? So Dr. Tess will tackle first questions related to reducing transmission of COVID-19. I don't think we have any questions on increasing resiliency. Everybody understands that. So we'll start with the second minimum health standard of DOH, which is reducing transmission of COVID-19. You've been able to answer the question on face masks, that this should be provided by the employer, but it doesn't have to be the kind that has to be replaced every day. Okay. Now, there was a question related to prolonged wearing of masks, and this is more medical. Since you're a doctor, I think you can also answer this. Is there a medical restriction or a known medical impact of prolonged wearing of masks? Doctors.
Okay, you know, as a safety and health person, this is where I'm coming from. Masks are really, you know, if you really talk of the protection from masks, it should be properly sealed. And that is where the medical conditions, because that really close seal will really provide problems for those asthmatics, those that might have difficulty in breathing through the mask. But now, because we are saying it's a cloth mask, there's some filter, but it will allow you to have, it's not that you know you will feel so restricted in terms of breathing. I hope it removes that fear or that difficulty. I know there are many types of masks, and that you might want to explore that. If it's going to be, you know, you might feel so restricted because it's so close to your face, so close to your nose and your mouth. Then there's the I think I have it here because I usually, and this is more comfortable for me, this type, where it gives me more space. And it's still good enough. There's still that barrier. What we're saying is just have that barrier so that it will stop, the risk of transmission is stopped. So we leave that up to you. So on that question, have something that they can be comfortable in using, but you have to wear the mask.
Okay, thank you
If
for
you
that.
cannot wear the mask, ask work from home.
Okay, so you have to wear the mask. It's up to you what kind of mask to use, what you're comfortable with. If you don't like to wear a mask, ask to be allowed to work from home.
Yes.
Okay. All right. So doctor, as we move to the second question, and this is all about the health symptom questionnaire. There are several questions here. Let's tackle first, because this was a guideline prior to entering the building. Now, most of the offices for ITBPM employers have offices, they're tenants in buildings. So they go through multiple entrances before they actually get to the entrance to their office. So the question is, to whom do they surrender the health symptom questionnaire? Because the guideline says surrender to the guard. So is it to the guard of the building or to the guard of the entrance to the office? And related to that, what will the guard do with his forms at the end of the day? If he has it, right? What does he do with it? To whom does he turn this over?
Okay, let's put it in the perspective that those questionnaires have are important. Okay. That questionnaire should screen. So on their first question, it should be before they enter the building. If there's multiple entry, even before they enter the building, they are screened. I hope that is clear. That's why I was telling you, find that isolate. If there is someone, then on that questionnaire, first kasi he will be scanned. There's, you know, you don't have to be temperature checked in each and every, tama na, outside. That's good enough, because before you enter and you have fever, you don't, no more, do not enter anymore. Stop, di ba? Now, again, and that questionnaire pa, if you have cough, stop, please do not enter. And the guard should know that if they see a yes to any response, that's why there should be training. And this is where we would like the whole of building. If, for example, for us in government, we're talking of a whole of government approach now, the whole of building, they should talk, oh, who will train the guards? Okay, now that this guard sees a yes, and there are health personnel there, who will be and whom will they call? We hope before the 16th comes, they already know. Oh, si guard will now call this. They'll put and the person now will go down and properly assess. It is really medical. They will have to properly assess this, but it has to be done. Again, the mindset here is to not let them enter because they have symptoms. There is a possibility, and you would like to isolate, di ba? If you see our now, it's like detect, isolate, and treat. So we're doing that. Detect through.
Doc, that's just to clarify. No? So if it's going to be done by the guard at the entrance, once you get through it, okay, no fever, no symptoms, surrender the form to the guard at the building entrance.
Yes.
You don't need to do the same for your company entrance card. No more na. So understood na yun. Pag nakapasok ka dun sa building, you can proceed to the rest of the other entrances.
Okay.
Now, what will the guard do with the forms at the end of the day?
That's why you have that protocol. Kasi if he belongs to, kasi the company A to Z, he will collect it na. This is for company A. This is company B. These are the
okay. All right. So there is a question related to that because we have, you know, naman the size of BPO companies. We are thousands upon thousands. So assuming following the model in GCQ, 50% will work from home, 50% will go to the office. So if you have like at any given time, you have 2,000 to 3,000 on the floor. So 1,500 pa rin yun, 1,500 pa rin yun na papasok. And it can cause a long queue or a huge backlog. So the question is, but you know, for me, medyo yung challenge dito is how to operationalize it. The question kasi they have is, can they accomplish the form online?
Yes. You know, we leave it up to you. The guidelines are set, but you know why they're there. We leave it now. If it's going to be done online, if they can even do it before they leave the house. Kasi, you know, which means 1,000, would you have 1,000 tablets out there? Or, you know, even if there's a queue to do it, but even if they leave the house, basta honestly, siguro naman, like if it's like, you know, a 1 hour travel, they will not feel suddenly sick in 1 hour, then they submit it. And then,
so they can have like, they can have an online form, pre-fill it up, and then just adjust it to reflect the temperature when they get to the, and then show it to the guard.
Then the temperature. The guard, you leave it with the guard, and then because these are now all technical and can I
leave doctors what we can suggest? What we can recommend is for the individual employers to coordinate with the building administrator. How to operation. Because I'm also seeing that, you know, if the building administrator only has one guard, parang ang hirap, no? Maybe that the different tenants in that building can coordinate and try to see how they can facilitate this entry. The important thing is they have the questionnaire where the symptoms and the temperature are indicated, so you can easily identify who not to let in.
Because the online naman is there, then because what your normal would be their normal. You will flag the one with fever.
Yes.
So you can, if that's why I'm letting you, I mean, I hope you can develop na, then you can pull out their online submission and put the fever, ganon, so that it's easy now for you. Then the rest you can fill up, but it has to be filled up pa rin. So,
Okay. So an employee that doesn't submit the form should not be allowed to enter.
yes.
Okay. That's
Yes.
all right. Pagdating naman, Doc, sa thermal scanning. Wait, there's a question pala. I'm not familiar with the Stay Safe app.
Okay.
They're asking if that can be used as a questionnaire. I'm not sure if all the questions in the questionnaire are in that app.
Okay, which reminds me, I should start then downloading that app. That Stay Safe app is a very good app for all, and it's free for now. Where you are putting all your personal details, and of course, even if because it also it has on symptoms. But if you have no symptoms, you're fine. But if you have symptoms, you have to put them there because it will track you. It will track whom you talk to so that there is good contact tracing also in that app. If your company, kasi now we're encouraging everyone to use Stay Safe, that would be good. Is that a good enough substitute? It tells you it gives symptoms, but I think there's also, and it has the same symptoms, sore throat, fever, but on the possibility that you went to another area, you just might like to explore all what's in Stay Safe, as well as even a questionnaire that is just a sample. You might wish to add more, or the doctors might wish to know more. We leave it up to you.
But the symptoms in the questionnaire are the minimum that need to be tracked.
Yes.
All right.
Okay,
okay, let's go naman to thermal scanning. So similar to the health symptom questionnaire, the building guard or whoever, the entrance of the building is assigned to do the thermal scan. Pag pasok na doon, if an employee or a person entering the premises passes the temperature, the individual companies do not have to do that at their company entrance.
Yeah.
Okay.
In fact, they're going to fill a questionnaire before they leave, or then they can put in their temperature at the at the point of entry.
Yes.
And then submit.
All right. My question dito, doctors, why are there different minimum temperatures? DOH daw says 38, PESA 37.2, and the DOLE DTI guidelines say 37.5.
Everybody wants to be a little bit more careful. Basically, that's because 38 is really fever. As a doctor, 38 is fever. The low grade, that's they say it's 38, but we on really being very careful, we're using 37.5 as our cutoff.
I think that's safer naman, no?
It's up to your doctor, but just to be a little bit more careful, yung 37.2 nga, para bang, okay, that's then they're a little bit more careful.
Because sometimes, like it happens to me when I walk to the grocery, walang sasakyan ngayon, di ba? And by the time I get back at the barangay checkpoint, I register 38.5. So ang ano lang doon is you take some time to rest.
Yes.
Okay? And your temperature should go down. Typically in 5 minutes dapat bumaba na yun.
That's why that's part of our protocol. The 37.5 is there 37.5. Wait, 5 minutes. Take it again. It's supposed to go down.
All right. Now to the isolation area. You mentioned this already kanina, that it should be an isolation area typically outside of the building because hindi ka nga papapasukin if you have temperature and the symptoms. You need to be isolated.
Or in the building pero yung hiwalay. Yung
basta hiwalay, separate.
Siyempre, kasi garahe na yung susunod.
Yung magtatanong, yung question kasi dyan, doctors, who is responsible for setting up that isolation area? The building administrator, or do the tenants have to, participate in the setup or the
because we will all be part of that.
Okay.
Kasi you don't want them to, stay in your. Kasi I saw that. Should you have your own isolation area? I don't think you would like them. I think you would like them just to go down that place and then do na tayo magkaano. Then let's all do the decision making at that point. But then if suddenly like you're 1,000 people and then 50 would, or even if 5, and it will also cause so much fun. Let's leave that. Put that isolation area in place. Talk as a building. Talk as the whole of building approach, so that you understand, and you will have the proper
If it
protocols
so
and guidelines.
happens that somebody develops a fever towards the end of the day, nasa loob na ng office, no? So in the guidelines for hold on, reducing the risk of infection says that this employee also has to be brought to an isolation area. Would the isolation area outside or dun sa baba suffice, or does the employer have to have a separate isolation area inside the office? And should this be different from the clinic?
Ano rin sa amin sa clinic, na nakakaawa din yung clinic kasi maraming pumupunta doon maski may headache, di ba?
Right.
So, that isolation area is really an isolation area for symptoms that may be COVID related.
So the employee so the employee has developed symptoms later in the day has to be brought down.
Down na. Right. And all decision on all the protocol should follow there.
And similarly, mag-co-participate na rin on ang mga tenants for clinic staff who will attend to people who will be isolated.
Yes.
That's our suggestion.
If there are many clinic staff, sana meron din assignments, but the PPEs are really very important. These are not now ordinary reusable masks. These are really medical grade.
Yes, medical grade na. Okay. And then you answered this already. Moving officers, preferably safety officer, can be a first aider for the office.
Yes.
And again, I think we'll just follow the same line of recommendation. For anything that is required prior to entrance in the building, we encourage the tenants to coordinate with the building administrator and co-share also the responsibilities for all enforcing these guidelines.
Yes.
All right. Okay, thank you. One more, for reducing transmission of COVID-19 inside the workplace, social distancing, you mentioned at the beginning, interim guidelines to, no? So interim meaning it can change.
Yes.
But do you foresee that DOLE will eventually come out with a department order putting in black and white na henceforth kailangan talaga 1 meter na?
Hindi ba yun sa guidelines? Henceforth 1 meter talaga.
Naghahanap kasi sila. Alam mo naman ang ating mga HR, ang hinahanap nila mga department order. Yes.
Ano yun?
So, the guidelines serve as a department order.
We just didn't like to make it an order.
Yes.
Because it's interim, but these are a directive na from DOLE and DTI.
Okay. There's a question. When you say workplace, is that synonymous to the work area? Like when you say yung in the workplace, 1 meter distancing, that has to be observed. Kasi some BPO companies, it's the same, right? Okay, same. Okay.
Yes.
And wearing of masks for call center agents because they need to be on the phone speaking to clients, no, to customers. And typically, masks kind of namamuffle sometimes yung sound. So can they remove the mask while in calls to eliminate communication barrier with customers? Hirap?
Okay, kasi talaga naman, even that's why even in eating, you take off your mask because you're eating, and now it's like you take off your mask because you're what we're avoiding is you are going to talk through a microphone or through a headset, and of course it's supposed to be personal, but if somebody picks it up and uses it, and you say, it's going to be disinfected, it's just only for me. But when you use that and when you remove your mask, the surfaces are now
infected. Can be infected, yes.
Okay. Yeah. So you are again opening so much, and if we do not like, but if you're an asymptomatic carrier and somebody touches that surface, you are again you might think ay sobra OA na yan. No, we do not know nga eh. That's why if we can do all the barriers and we have all the it's a little bit we we are putting so much importance in, but that is the only way to prevent.
So
And
in
if you can
short,
just
we
wear the mask.
not. Yes. Okay. Siguro they can experiment kung anong klaseng mask
Yeah.
yung pinaka-least.
Oo. So
May
that they
question
can,
na humabol, Doctor, sa isolation. The person, the employees or the people who will not pass the health symptom questionnaire questions and the thermal scanning, can they have a policy of just sending these people home or asking them to the hospital so that they no longer have to put in place an isolation area or isolation tent?
no, that isolation area is not just for people who will not answer that questionnaire.
Hindi, no. Yung may sick daw. Halimbawa, yung sick, na malabas na may symptoms or medyo may fever, can they not have the option just to send these people home instead of having to isolate them and put them in the isolation area?
And bring them there right away. But what if it's just like I said, there might be other causes. Toothache lang ba? I mean, I don't know.
I get it. So put them in the isolation area and have them assessed by clinic staff. And then those who are sick with something else and can be sent home, send them home na. Okay. All right. All right. Okay, so that's clear. All right, so we move now to minimize contact rate. Okay. One question you already answered, that how short is short for a meeting? 15 minutes. And then unidirectional movement or layout. If the work area is small to medium, do they still need to follow this?
Try. Kasi you do not have that face-to-face. Kasi that's why, diba, 50% that's social distancing. So if you can start moving tables so that there'll be like more aisles that they can pass through, one going to the right and one, then that would minimize. What we're talking of here is really...
Parang ano lang kasi yan, one way lahat, no?
Yeah, oo. One way lang talaga lahat.
And then, I think this is more of an IATF guideline. After May 15, assuming NCR or the ECQ areas move to GCQ, is there a specific percentage of workforce that will be allowed to work on site from May 18th? Doctors, please confirm if my understanding is correct. I think the IT-BPM sector belongs to category 3 of the industries, and under GCQ, 50% kailangan work from home and 50%
look at the omnibus
on site. Okay, can you just check please?
Yeah, can I just check the omnibus guidelines, because that would be or ask na lang first while I'm checking so that hindi tayo mag...
Okay, I think that's the only question we have under minimize contact rate. Okay, yung reducing risk of infection, definition ng employee suspected of COVID, asking if this is the same as the DOH definition of suspect, probable, and confirmed.
Yeah.
Yes, it's the same.
Yes. Oh, ito na ha. I'm going to read the omnibus. Category 3 industries, which is the financial, BPO, legal, accounting, etc., and other non-leisure wholesale retail, at a maximum of 50% work on site and without prejudice from work from one another. It's 50%.
Okay. 50% maximum. Okay, so that answers the question. I think we have 2 questions regarding that. All right. Okay, so reducing the risk of infection, when the guidelines say that an employee suspected of being COVID needs to be brought to a hospital, the challenges though kasi is it takes a lot of time to get hold of an ambulance. Okay, so the company has to bring the employee to a hospital or to a health facility. There's a danger of infecting or exposing the driver or a nurse kung kailangan pang samahan, which means they'll also need to quarantine this personnel. Okay. So, parang ang question is, kailangan ba samahan? Parang ganon. No? And then the second question, doctors, is if the employee declines to go to the hospital, can he or she be made to sign a waiver? and just ask the employee to just go home or have his family pick him up?
Okay, ganito. Especially if you are suspect and you're a POM, PUI, it's already very important. Have protocols ready for the ambulance conduction.
Okay.
Make sure you have hospitals, or the referral hospital, especially for COVID, that you can access. That's why, again, you need the isolation room. It might not, like in 15 minutes, andun na. He might still wait because you are, but have it ready because we're really looking at ambulance conduction. And if there's any waiver, let it be done in the hospital because he has to be monitored by the barangay.
Yes. Since you mentioned barangay, they can also ask assistance. Some barangays have their own ambulances,
yes,
right? Okay, thank you. Can the exposed contacts, like the driver or nurse, kunwari sinamahan, no, to the hospital, can the company also require the contacts to be subjected to PCR testing? Hindi. Parang PUM pa lang sila, di ba?
Oo. Pero kasi parang if it's so early done, that's what's with PCR, baka hindi ma-detect. So, they still need to be quarantined anyway. You have
quarantine na lang muna. Yes.
Oo.
And then if the employee turns out to be negative naman sa test, balik na uli sila.
Or pero pa-assess mo rin maigi.
Okay.
Kasi he might be negative but then there might be other sources of exposure then. So just let them still be assessed properly.
Okay, thank you, doctors. The guidelines under reducing risk of infection, there is also a guideline that says company protocol should be set for ambulance conduction and for PCR testing.
Yes.
They're asking, can you kindly clarify what kinds of protocols they should arrange for PCR testing?
Okay. Now we're going to the PCR and rapid test. We really, PCR is the gold standard. Let me put it up front. But PCR, if you're also, it may miss, ang sabi nga nila, it can miss a percentage as well. But if you are symptomatic, it will pick it. You will be able to pick it up. And if you are now symptomatic, and that's why, di ba yung PUM and PUI, that's why we said, and it's in the guidelines that we said, PCR na yan. But if you're bringing in like a healthy working population, I just want them tested. The discussion has been so contentious. It's up to you, but understand what a negative rapid test means as well. Because he might be negative now, but remember, rapid test kits need to be validated, number one. And if that they might be false negative is also another thing you have to consider. There is a value of a rapid test kit after quarantine because it will pick up that kung nag-quarantine na siya tsaka negative sa IgM, IgG, edi wala talaga.
Yes.
Pero kung nag-positive siya sa IgG, edi kasi nag-develop na siya ng antibody. So that is also, so again, it's how you will look at all of this. But kung negative nga siya in the beginning sa IgM, IgG, will it always be negative?
May false negative.
May false negative at kung ma-expose naman siya.
Yes.
Right. That's
okay,
why,
so since we're talking about COVID testing, ang daming tanong dito, doctors, but I think you actually answered most of them a while ago in your presentation kasi most of the questions are asking, required ba ang employers na ipa-test ang mga employees before the employees will be allowed to come back to work on site, the 50% that will have to work on site. In your presentation a while ago, you said it is not a requirement. Okay, so if DOLE, DTI, DOH are not requiring employers to do testing. Okay. But employers may if they like. Okay. Now the guidelines say that, hold on, just saying that company policy on COVID-19 testing shall be formulated and agreed upon by employers and workers in conformity with the DOH protocols. So in a sense, are we saying that the company cannot require employees? The protocol has to be something that both workers and employers have to agree on. Kasi yung question na pag require ni employer, ayaw ni employee, paano yun?
Hindi, kaya nga sinasabi namin, have that policy that is signed off by both. Now, if you look at the DOH, wala talagang testing doon, alam nyo ba? It is quiet on testing. But then we also understand that companies would like to look at a parameter so that at least may sense of ano ba sila na comfort that negative pero hanggang saan. Anyway, but again, because kasi it might also not be good. Like I hope that wala naman discrimination to the worker. Like that's why if it is properly explained that okay, this is going to be done, but if you're positive, you'll just be quarantined and have it retested, and you go back to work. Mag-agree naman sila kasi they know it's for their health. But then if it's positive, then you'll be taken off from work.
Cannot be done.
Should not like to happen.
So the policy is something that the company can formulate with. It has to be signed off by the workers and the employer. The policy can go as far as saying, if you test negative, we will request you to go on quarantine, but the policy cannot go as far as saying, if you're negative, you will be dismissed from work or...
positive, you mean? If you're
positive, sorry. Positive, right. And then, if they're using rapid antibody test kits, these have to be, those who test positive for that have to be validated with PCR testing as per DOH protocol. Right? And not anybody can do that. I think the DOH requirement is that antibody rapid test kits, the purchase of this have to be on the prescription of a licensed doctor. Usage or administering of it has to be monitored by a physician. And interpretation of the results has to be by a licensed physician.
Yes, correct. That's all in the protocol naman ng DOH.
And PCR testing analysis has to be with any of the DOH licensed testing facilities. Yes. Not some hospital on the side. Is there a place, Doc Tess, where the brands of the FDA approved brands ng rapid test
kit? Up to them. They say there's so many FDA approved, but again, the validation kasi is also what is required.
Okay. But is there a list na parang itong inapprove ng FDA na PCR test and rapid test kit, antibody test kit?
Sabi nila meron daw, but we never...
We can check, no? We can check na lang. Kasi maraming nagbebenta niyan, doctors na
alam ko. Meron. Yeah.
Okay. All right. So again, para lang malinaw, kasi ang daming questions, hindi na ako, Pauline, who is sending me the questions via messenger also, hindi na ako makahabol, no? But just to confirm, COVID-19 testing is not required by employers, is not required by DOH, DTI, DOLE. Employers may want to test their employees, but any policy on testing has to have the sign-off also of workers. Okay? Yes. So, yung questions na hindi ba pwedeng pumasok from work from home or from temporary accommodation yung employees kung hindi magpa-test, ang sagot doon, depende sa, hindi sila pwedeng hindi papasukin. Kasi hindi requirement ng testing. Okay. All right. Okay. At the question naman for most at-risk workers and vulnerable groups, if employees who are under this grouping or risk, most at-risk and vulnerable workers are among those identified who have to physically report to the office, can these employees exercise their right to refuse work due to imminent danger? And if so, what kind of documentation do they need to provide? Kakambal niya, hindi kasama dito sa at-risk or vulnerable. Pero takot lang talaga yung employee or ayaw lang talagang pumunta sa site. Can they be sanctioned, disciplinary action following due process?
Again, this disease has created so much, policies then should be made and signed off so that the workers understand. Anong una, kasi what was the first question? They do not like to go
Can
back.
they right to, for those who are at risk or vulnerable, may mga diabetes, may hypertension, if they are among those identified to report to work on site, can they refuse based on imminent danger, the right to refuse
It's not
work?
imminent danger, but remember, even the guidelines say that those most at risk shall be allowed to work from home.
Okay.
Oo. First, they use that policy so that, and companies sana, by this time, should start developing, sino na, sige, ito, mga work from home, ito na yung mga assignment nila. Admin, yan. I mean, you have to innovate and create. There will be workers who will have to work from home. You cannot take that out because meron na, by this time, may mga, like me, I'm 60 na, or those with comorbidities. They may be young, but again, you have to deal, and it is part of actually that was also the pronouncement of the president when even in the beginning, although that was ECQ, and he said work from home is what is being promulgated. But of course, now that we're going to GCQ, there is still work from home because they are still most at risk. So
Kung hindi high risk, tapos they don't like to go, they refuse to go to work.
They're not high risk, but they refuse.
Yes.
May policy na kayo doon.
Kailangan, company policy na. Okay.
Oo, mag-policy
Pero
na.
what about yung kabaliktaran? High risk kasi may comorbidities or above 60, pero gusto niyang pumasok.
Alam ko, meron din yan. Actually, meron yan eh. If even in the omnibus, seniors, those 60, they can go to work, they're allowed to do that. But lessen the time. Again, company policy.
Okay.
Lessen the time.
Lessen the time on site.
Yeah.
So pwedeng yung balance work from home. Kumari 5 hours a day, 3 hours pagdating mo na sa bahay. Continue.
Or else MWF siya sa bahay, TTH siya sa work.
Not every day.
Okay.
Para ma-minimize lang yung paglalakad.
Oo. And then when he is at work, you also take care na he's not unduly exposed. Or they are not unduly exposed.
Okay. Assistance by DTI and DOLE, will there be a dedicated section in the DOLE website that companies can refer to for guidance after the government imposed quarantine or when we move to GCQ?
parang nakikita ko na sa BWC, maglalagay ako ng COVID-related.
Parang ganun na nga.
Oo. Sige.
Pwede. Oo daw. Okay, pwede. Alright, pwede. Okay. Doctors, reporting illnesses, diseases, injuries. So meron tayong WAIR, di ba? Ilalagay din ba sa WAIR yung mga naging suspected lang?
Oo, sana. Yes. I mean, really, we would put that there. But then ang DOH ang sinasabi nila, please report those who are positive. That's why we're saying bring them to the hospital because the hospital should report to the DOH.
Yes.
Para we lessen that reporting because then you have to report to the DOH.
Sa DOH, sabi WAIR should be copied. DOH should be copied in the WAIR. Sa kanino po doon sa DOH?
Oo nga eh. Send it to us na lang first and then we will just do the necessary
Okay. Thank you.
And
then tapusin ko lang to and then marami pang questions. Effect of future guidelines. Will DOLE be drafting health and safety guidelines for those who are working from home? Kasi ngayon, ang working from home, ang office namin, home. Hindi siya considered as part of the official workplace. So yung question is, as this becomes part of the new normal, magkakaroon ba kayo ultimately ng OSH guidelines for those on work from home?
So, let me. And many of you were there. I'm not sure, Tess, everybody remember when we were talking about the Telecommuting Act?
Yes.
In the Telecommuting Act, which is work from home. And there was safety and health. And, although the telecommuting law is voluntary, but safety and health there was a very important item. And we said they should be looking at the proper safety and health tools for workstation. Nandun naman na and ang sinabi pa nga natin doon, picturean para si safety or the safety officer in that should give the parameters for the proper layout and design for a good workstation workstation area if you are doing work from home, which, you know, in my area is
So
not.
it can happen, no? Na
Yeah.
ultimately.
Oo. You just use, I mean,
Ultimately, no? Pwede.
oo.
Yes. All right. Other questions na hindi na tungkol dun sa guidelines. DOLE inspections. Business, ngayon daw na naka-GCQ, will DOLE be BAU, business as usual, in conducting inspections of the workplace? And whether the answer is yes or not. Will these interim guidelines be part now of the checklist that safety officers or inspectors will look for when they visit the company?
Let's see. Let's do the second question first.
Mm-hmm.
With the guidelines, we did not put anything on enforcement nor penalty.
Okay. All right.
What we want in the guidelines is that you know the value and you comply the best way you can.
Okay.
DOLE will assist. Kaya nga nakikita mo pa doon, assistance.
Assistance, yes.
Oo. Walang enforcement because sa usapan dito, hindi na namin kayo ipupulis sa ngayon dahil hirap na ganito. We know conditions are hard. The economy has suffered. Companies have suffered so much. Then we're asking you pa to provide the mask, to provide the soap, the sanitizer, the disinfectant, the thermal scan, all of these things. But, you know, we know it has to be done. You have to comply because we are lessening the risk nga eh. If I use the we want to flatten that curve. Anyway, so the assistance is there. Will inspections, it is going to be, and this we're already talking about it in the DOLE, it will be more technical assistance than inspection. But if there will be any complaints na may willful, remember, this is safety and health.
Willful neglect.
We're talking of PPEs, we're talking of safety and health measures, even the social, physical distancing, that's safety and health. If there will be any willful then it is still going to be inspectionable. But we are trying to avoid this. What we're saying, we will do all assistance. We are not really, I mean, our inspection mode on a business as usual is also not yet happening because we would like companies we're stimulating companies to start up. So,
so if there is willful neglect or willful omission,
violation.
Then that will be evaluated separately, no?
Yes.
Okay. All right. Compensation. Okay. And that.
Sorry. Good afternoon again, Tess. I don't want to disturb you, but there's just a request on the floor. If we could communicate in English, as some of our audience are unable to understand, and this is very critical. I'm so sorry about that.
Okay. Thank you for the reminder, Indu.
Great. Thank you so much as well.
All right. Okay. Compensation. How should employers be required to pay employees who are under quarantine? I think in the ECQ, in the beginning, Dole said that nobody loses his or her work because they have to go on quarantine. So under GCQ, will there be changes as far as the guidelines for compensation for those who may be required to quarantine themselves, or for those who have to work from home or go through reduction in?
Okay. It's easy to answer the work from home because that's still pay. Those are wages, and that's why we were saying that's why we were saying please have your target deliverables because you will be paying them their wages. It is going to happen. Now on leave entitlements, it was already earlier said that if it is a forced quarantine, the 14-day, it will not be deducted. It has not going to be deducted from your leave.
Okay.
So it has not yet been repealed. We have not yet removed that even now as we approach GCQ. But so it's still standing for now.
Okay, standing for now that those who are on forced quarantine or will be required to go on 14-day quarantine, the leaves cannot be touched.
Yes.
Okay. Do they have to be paid in full as well?
Yes.
Okay. So for now. Okay.
For
it
now.
can change. Okay. Okay. How will the company compensate non-production or operations personnel, such as janitor, messengers, and other utility personnel, if most of the workforce is working from home? So I am thinking these may be companies whose janitors, messengers, and personnel are full-time employees as well, rather than, you know, through a contract with a provider.
So there, kasi I mean, the way I understand this, so you are not anymore going to bring in your janitors, but I think you need your janitors more now because they need to disinfect every 2 hours.
If they come back on site.
Ah,
but what if most of them are
if
working from home now?
Okay.
So there's no work for the janitor to do,
Yeah.
or the security or utility personnel.
Yes.
And if they are employees, because I'm assuming if they are from an agency, then that's the agency's problem, right? Okay. But if they are the company's full-time employees as well,
yeah,
is that going to be connected to? I have a question on, and it's actually the last question I have on the pre-sent questions. No, it's related to redundancies, because there's a question about 20% of their staff is currently under no work, no pay policy. But as time goes on, they're proving that the model can work, a work from home model.
Okay.
Their employees, and because their clients have also lost business, they've lost their clients, such that when we move to GCQ, they may no longer require the services of these 20% personnel who are currently on no work, no pay. So the question is, what options would they have for a reduction in force where they will not be subjected to NLRC cases?
Okay, like I mean, let me try to as we move to GCQ, and we're also seeing the difficulties of many companies, we are trying, I think there are measures now that are going to be put in place so that there will still be employment preservation. I do not have the exact details, but what we're saying is try to have the workers still there so that, you know, as everything starts with a stimulus package, and as markets open, we hope they will not lose the workers. But it's still being developed. You can wait for it, but if you feel at this point, you know, you're financially, you just have to, of course, then do the proper separation. Everything should be properly done. The policies on separation and then please notify the dole as well.
Okay. So as much as possible, if they can keep their workers,
yes, we would
exert all effort to do that. But if it's no longer practical, then just go by the usual dole process, for redundancies.
But try to wait. I know we're also trying to fast track the stimulus packages for companies so that there is still employment preservation.
Okay. All right. So that's the end of the list that I sent you, but we have a few more questions. We do a time check. We're at 3:35. We can accommodate a few more questions that were sent through our chat, Q&A chat boxes. Let me see. Okay. This was answered before on the mesh, on the OSH mandatory change, the mesh. If it can now be done through wire or online. I think from the beginning that was the position, right? It's totally up to the company how they will conduct their mesh training.
Yes.
As long as they complete 8 hours of the training and the prescribed curriculum, and all employees have to take it.
I'm still glad people interested in that on the orientation. Thank you.
Okay, so there's a question, Doctor. This is not about the interim guidelines, but about training requirement for first aiders. Since we mentioned that the roving officers preferably should be safety officers, if not the first aiders. There's a question about the training requirement for first aid training is, if you know, okay, is it standard first aid training of 4 days because other inspectors are not honoring occupational first aid training of just 2 days?
It's already, I think the occupational training of 2 days has been recognized already. And I think that was also part of the agreement of the DOLE. So we will just inform our inspectors.
Okay, so 2 days is sufficient.
Uh-oh.
Okay. 50%. Okay, in relation to the 50% workforce requirement, for 50% maximum who will be allowed to work on site, is it 50% of total employees overall or 50% per shift? So if the shift says there are 500 per shift, so 250 at a time, or are we looking at the total workforce?
If you add it, but isn't it the same? Like if we talk of a total workforce of 1,000, and which means the 50% is 500, and the 500 is divided into 2 shifts. Ganon ba yun? Then that's 250, 250. Or in every shift, but it's less than but it's really looking at the whole workforce. That's how we appreciate it. That 50% is now on the total workforce.
Are employers required to pay for the connectivity fees for people who are working from home?
Oh, remember the telecommuting law? I will have to bring you back into laws that have already been passed.
Okay.
In the telecommuting, there were many the connectivity is already an accepted responsibility of the employer. Kasi you're removing certain benefits from the worker. Like you're not anymore giving them like meal allowance, uniform allowance. Then at least have that connectivity cost as, one of the responsibilities of the employer.
Okay. So talking of allowances, for people who are working from home, is it legally allowed to reduce some of their benefits? Like, for example, transportation benefit, they're no longer commuting.
Yeah, yes. But in the telecommuting, there is also a clause there on non-diminution of benefits. That non-diminution really just refers to a unilateral removal of benefits. Okay. But if it's that it's agreed that okay, there's no more transport, and it's agreed, that's fine.
It's a variable kind of benefit. Okay. There's one question. When we move to GCQ, will employers still be required to provide accommodation for the people that they will require to work on site?
Pardon?
When we move to GCQ, will employers still be required to provide accommodation for the employees that they will require to work on site?
If it will be more practical for them, why not? Because like I said, transport is still going to be a limiting factor.
Okay. If they can provide transportation,
they can. Yes, that's good.
It doesn't have to be both, like accommodation and transportation.
If they can provide both, that's fine too.
Yeah. Okay. So, but the important thing is to make sure that either through providing accommodation or transportation is to minimize the exposure that the employees will have to.
And remember, if you provide the transportation, it goes without saying you're going to disinfect those vehicles as well. Or if it's a contracted vehicle, make sure that there's also proper disinfection.
Okay. There's a question on expectations with respect to public transportation. I think the ILG covers that, or
no, the OTR.
The OTR covers that. So they have the guidelines.
They have the guidelines already.
It's not under you.
No. But they have the guidance. We already saw the guidelines.
Okay, all right. So we'll just refer to those guidelines for the kinds, because the question is any advice on the types of transport that their employees can take coming to work.
Okay. They're opening, of course, the trains are there. If there are buses, but they are going to be, it's still 1 meter. So it's 50% of the usual passenger capacity in buses. And then the others that are allowed, there will definitely be a reduction in terms of passenger capacity as well. Even for the if they provide shuttle, they're not packed to the full. It's still 50% passenger capacity.
Okay. There's a question here clarifying our statement on not touching the leaves of employees who are forced to go on quarantine. Is this sick leave or vacation?
Kasi no, you're not touching any leaves anyway. So you're going to maintain the sick or the VL. Okay. Thank you for this, because we will discuss this, but it was already clear that if you are forced to go on quarantine, or we can call it a quarantine leave, then you will not deduct any sick nor vacation leave.
Okay, but it can still be discussed, the sick leave part.
Yeah, we'll discuss.
I think the question there is, people who have to go on quarantine, are they technically considered ill already? And
they're technically considered as isolated, so that they will not they're guarding against
it's a preventive
preventive
isolation
approach. Yeah.
Okay.
So
right now, as of now, don't touch the leaves.
Don't touch the leaves.
But you will certainly table it for discussion, especially the sick leaves.
Yeah.
Okay.
We will table it.
Okay. A question on expenses. Are employers also required to cover electricity expenses of people who are working from home? I guess the catch-all question is, for people working from home, what kinds of expenses will employers be required to cover? So we talked about connectivity. There's electricity.
Yeah, the connectivity was I mean, if I will go back to the telecommuting, then it was just the connectivity, and of course providing the laptops, the equipment.
All the others it's up to company policy.
To the worker.
Okay, will there be more money provided for camp?
Well, there's no more. I mean, by April 15th, it was already. You all know that it was SSS that took over camp. So we were finished with camp. So we don't know though if there will be future assistance. It will depend. It will depend also, because really now the government is also really struggling in terms of providing all this financial assistance.
Okay. Time check. Let's just take 5 more minutes to address a couple more questions. And then after that, those that we will not be able to ask, we will ask doctors offline and then put together a document that we can share with the participants.
Okay.
Okay. There's a question on DOLE or PAGCOR. I'm not sure if we have members who are under PAGCOR as well. But the question is, which guidelines should we follow, DOLE or PAGCOR?
For
POGO BPO? Because I think that there was a statement from the palace that POGO is under BPO. When it comes to testing before reporting back to work, and it cited a quote from PAGCOR saying, those who will report back to work, whether Filipinos or foreign nationals, must be tested for COVID-19 and must obtain a negative test result from a testing facility duly registered with the FDA. Actually, it should be DOH.
That's PAGCOR, di ba?
Yes.
Yeah, and this is for their. Yeah, because PAGCOR is the one that regulates for the POGOs.
So if a member company is also under PAGCOR, their operations are under PAGCOR, they have to abide by the PAGCOR requirements. Okay. Okay. I think we've covered. For a company of just 10 to 20 employees, is there any way that they can require or request COVID testing for their team? It's a company policy.
Yeah. Just and understand what all of this means.
I may just inject some perspective, because I do listen to DOH a lot. I think the challenge, it depends, if you were looking at RT-PCR testing, the challenge there is that they're making sure that the current supply of RT-PCR testing goes to the priority people who have to be tested
Yes, and
versus testing indiscriminately.
yeah, but we are also trying to ramp up testing now, and
Yes.
but there are still, like, even if you're ramping up testing, that they were looking at OFWs that need to be
Yeah.
tested, and that is really running to the thousands.
Okay. I think I've covered, because some of the questions that I see here are similar to the questions that already have been asked. So with that, I'd just like to assure the people.
Tess,
Yes.
sorry, can I just have some other requests and questions coming
Okay,
in?
go ahead.
So similarly to, aside from, as we all know, employers try to create an environment for their employees post-COVID that's related to health and wellness and things like that. So do you have any recommendations on how we can move forward? Can employers still conduct, for instance, health and wellness sessions such as yoga or meditation or things like that within the office, with being mindful of social distancing?
And I would like to, I remember a question that I read a while ago, similar to that. There are employees who belong to one of our members, and when they work, they do some stretching and some physical exercises in the company terrace or veranda, mindful of social distancing, but they have been reported by their neighbors. Okay, so is there a guideline? And in this, to match it with Indu's question, is DOLE recommending providing opportunities for exercising inside the workplace, mindful of the protocols, the social distancing, and the mask, and disinfecting guidelines?
Kasi I think, okay, is it category 4? Because category 4 will not be allowed to operate. And category
the fitness centers, right?
Amusement, gaming, fitness establishments, but these are fitness establishments.
Yeah, we're doing let's say yoga. If in a training room, mindful of guidelines, distancing.
Yeah, but if you can do it like in your workplace, this social distancing, and it's part of a work activity, and not because there were questions asked again, like, why are we not allowing all of these leisure activities, or that? It's because the secretions, when they're out there, it can stay long in certain areas, and they do not like that. So if you're going to do yoga, wear the mask. But if somebody reports you're supposed to do work and not that, let me clear this then with
Okay.
DTI, with my
Okay,
with our
so
partner.
for now, let's put that question. Let's park that question. For now, exercise at home.
Yeah.
For now.
For now.
Okay. Thank you so much for clarifying that. Doc Tess, we just want to ask you, so, as we start preparing, more and more questions will come about, more and more clarification. Is there a suggested route that you recommend our members from the industry to get feedback? If it may not be today that they can submit their questions, if they have some next week, what is your suggestion?
I think I was telling that to Tess that, in the Bureau of Working Conditions, we'll start putting up a site for questions on COVID-19 and the workplace. And we also hope we can bring in DTI, especially if it is already something, if it's also DTI related, so that we can work together, because we really work together with DTI on this. So we will, as soon as we get, I will ask our staff to create a Q&A portion in our website, so that you can put in questions that may on referring to these guidelines and COVID-19.
Okay.
Okay, great. Thank you very much. And thank you, Tess, as well, for leading the Q&A session.
No problem.
Doc Tess, I know you must be exhausted from all of that, but we really,
I have
appreciate
to do another video conferencing.
Oh, okay. Thank you very much. So We will be sharing your presentation with our members, and we do really appreciate your time here today. IBPAP and Globe Business really thanks you for your time. For all the other members on the chat, we do hope you can provide us feedback. There is a QR code that will be flashed, and we would greatly appreciate your comments, feedbacks, and insights on what you would like to expect next. Before we wrap this session up, I'm just going to quickly hand over to our Executive Director, Frankie, to just say a few words.
Hello, good afternoon, everyone. This is Frankie Antolin, Executive Director for Talent Development at IBPAP. So first of all, I wanted to share our thanks on behalf of IBPAP and the IT BPM industry to Doc Tess for spending this afternoon with us, sharing the guidelines and your guidance as we try to wade through the different areas of clarification that we have around the DOL and DTI interim guidelines. So we'll make sure that we share all of the, or collect all of the questions that have yet been to be answered, and we will send that across to our membership, and we'll watch out for the website or the communication channel that DOLE is going to put up so that we can continue to communicate. I wanted to thank as well Globe for your partnership in this event. Really appreciate your support, and this has been a very informative session. We're very happy to have welcomed over 300 attendees in this session. And like we have been saying, there will be a deck to be shared with everyone. All of your questions have been captured, and we will ensure that we work with Doc Tess and her team so that we can get the answers to you. So finally, on behalf of IBPAP, thank you, everybody. It's been a great afternoon, as well as a very informative 2 hours. Thank you.
Thank you. Thank you all again. And don't forget to get that access to the QR code and give us feedback. Have a good afternoon to all.